Hi, Dr. Shannon.
Hi, Dr. Maura.
How are you?
I'm good. How are you doing?
I'm good. Thanks for chatting with me about preconception, one of our very favorite things to work with. And, and
Absolutely.
and yeah, you the expert. So tell me about like what is the importance of preconception prep?
Yeah, so preconception preparation is important for a number of reasons. Um, Probably the biggest one is the correlations we know between our health and behaviors prior to trying to conceive with the likelihood of us conceiving.
Hmm.
Um, and it's that health and those behaviors that also contribute to our health during pregnancy, in the postpartum period, and ultimately will contribute to the health of the child that's being
Right.
conceived as well.
Right. Yeah. It's inarguable at this point.
Yeah,
And so much data behind it and so much we can control pre-pregnancy, right? Which it gives us a lot of tools. So tell me how when someone comes to you, how long do you typically like to have to work with them prior to getting pregnant?
so yeah, I always recommend 3 to 6 months, and that's for a number of reasons. Uh, a few of the big ones are if there is anything going on, any pre-existing conditions that need to be addressed, any hormonal imbalances or conditions like PCOS, where we need to regulate a cycle,
Hmm.
to check on, like, to get insulin sensitivity in check, things like that take
Yeah,
time.
takes a
So it's
while. Yeah.
it's nice to have a few cycles to work with.
Yes.
And then another big one, it would be like egg quality. So we know that the follicle that's going to eventually be ovulated, and then fertilized, that follicle takes about 3 to 4 cycles to mature.
Mm.
So that's about 3 to 4 months to positively impact the health of that egg.
Yeah, 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 and so many things that go into that ultimately, right? And even repleting nutrition can take time. I mean, the body
Yeah,
doesn't. We always say this in terms of really treating cause. We need to give it a little bit of time, but if we have a month or two, we can also affect things as well. So,
absolutely.
ultimately, any amount of time we can put into it, I find is going to be positive.
Yeah.
So top three
Definitely.
things we were talking about this. Like, number one, what is the first thing you kind of think about and try to work on with someone coming in?
Yeah, I definitely want to talk to them about their diet and lifestyle. So typically I'll start by doing like a diet recall, getting a really good idea of what they're eating day in and day out, and then
Hmm.
assessing if there's um, potential for any nutrients that they're missing or lacking.
Right.
And I always coach them really at this time to emphasize things like protein, fiber, omega-3 fatty acids, antioxidants, things like that that are going to contribute to fertility and egg health.
Super important. Yeah. One of the questions I get a lot, and I know you get, is prenatal. Like, is that something you think about out of the gate, or do you tailor that to a person?
Yeah, that is a great question. And it's, I think, one area that naturopathic medicine really shines. So, kind of going back to like preparation timing, I like women to be on a prenatal 3 to 6 months in advance
Yeah.
for some reasons we talked about, like replenishing and optimizing nutrient vitamin levels.
Hmm.
Um, and then in terms of which prenatal I use, it's specific to the patient. If they have,
Yeah.
a pre-existing health condition, maybe they've been on a medication for a while,
Mhm.
or um, I don't know, have a family history of something, I'm going to
Yeah.
pick the most appropriate prenatal for them.
Yeah. Because there are so many, right? I mean,
There's
yeah.
so many on the market now that,
Yeah.
like, a huge range of the
Yeah.
vitamins they include and then the doses of the vitamins that they include.
Yeah, 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 exactly. And then speaking of that, functional testing, obviously we do a bunch of. I mean, that's sort of like our other kind of big thing. Talk to me about that and can
Yeah.
you assess nutritional status through that testing? Yeah.
Yeah, definitely. I have some preconception lab work that I run routinely on patients where
Yeah.
I'm assessing their a number of nutritional markers, looking at things like iron, B12, folate. I look at their metabolic markers, like their insulin and insulin sensitivity, blood glucose. I'll do some basic screening where I'm checking for anemia, infections, kidney, liver health. And then I'll also do some hormone testing on specific days of their cycle to just make sure that their menstrual cycle is being orchestrated the way it should, that's, conducive for conception.
Yeah, that's great. And sometimes I'll add in some of these other functional tests. People like, can we optimize, gut health or other things, kind of the terrain if people are coming in with specific complaints additionally, right? So
definitely
think about. And then lastly, another big category, we were talking about this final thing we talked, what it seems kind of like a no-brainer, but right, we see this a lot.
Yeah, cycle tracking and determining your fertile window. It's unfortunately something that, women just aren't taught. It's not in our high school health education. And so a lot of us don't even think about it until it's, time to start trying. And even then, I feel like there's a lot of apps and things now that are like, here's your fertile window. And they're not using any measurement other than like maybe when you got your period, which is just, we know is not the most accurate.
Right.
So yeah, I'll talk to patients at length about different ways of cycle tracking and just try to make sure that they feel really like confident and competent about, doing that month to month.
Yeah, exactly. Great. A lot we cover in those first couple of visits in preconception. So this was
definitely
super interesting. Thank you so much.
Thank you, Dr. Maura.